Gallbladder wall. Gallbladder wall should not be greater than 3 millimeters. Junctional bowl, phrygian cap. Phrygian cap is connected to the gallbladder. So, fundus, body, neck. Pretty good. Fundus, body, neck, Hartman's pouch, junctional bulb, phrygian cap. Very good. Very good. Y'all did great. Okay. So, whenever I'm taking images, transverse fundus, transverse mid, with and without measurements, transverse neck. Okay? When I do this, yes, I'm probably going to see gallbladder, I'm going to see liver on both sides, especially at the neck. Okay? So, side closest to the spine is always medial. Mid, with and without measurements. Some places do with and without color. Okay? It should not measure greater than 10 centimeters. Okay? And then sagittal lateral. Okay? So, it should be less than 4 cm in transverse, less than 10 cm in sagittal, less than 3 millimeter wall with zoom. Okay, so the patient comes to you and they say, I ate. I said, oh, you did? Well, what'd you have for breakfast? Oh, I just had a piece of dry toast. Okay, well, I'm gonna go ahead and see if I can find your gallbladder. So she said, yeah, I had a piece of buttered toast and a piece of bacon. What am I gonna see there? I'm gonna see a contracted gallbladder. Okay? I'm going to tell them, I'm already a registered sonographer. Okay, I got everything done but the gallbladder. Okay? I'm gonna go ahead and let you go and come back. I get off work at 3:30, so come back at 3 o'clock, ask for me. Don't eat or drink anything before you come back. And I wanna look at your gallbladder again. We have permission from faculty to do that. But first, find out what your procedure is at whatever facility you're working at. Okay? I don't want because first off, they had to go to the doctor. They probably had to wait weeks to get into the doctor. They probably had to wait 3 months to get an ultrasound appointment. They've waited in the waiting room now for 2.5 hours. I'm going to get them done. I'm going to get them done. Okay, now I'm going to get them done that day. Okay? So, and then they come back, they ask for you, you just take some pictures of their gallbladder, so that's 6 pictures or 7 pictures. We're not counting the ones with and without measurement, with and without color, because those are already frozen images. Okay? And then they can go on their way. Okay? Because if they have an increase in LFTs, it could be because of gallstones. It could be because of their liver function tests are high because they might have a fatty liver. Their liver function, and what are gallstones called? What is that disease process called? Cholelithiasis. Okay? Now, when you see cholelithiasis inside the gallbladder, you always do supine and you do left lateral decube. So when we move the patient, okay, so when we move the patient, we have to tell the doctor anytime we're not supine, anytime. Because if I have cholelithiasis, I've got to make sure that that stone moves.
Natalie done one.
Did she? Mm-hmm. Yeah, we've got to make sure that that stone moves. Okay? So here's my gallbladder. And here's a stone. Okay, so I see that there's a stone. Okay? So the first thing I'm gonna do is I'm gonna do an LPO. And I'm gonna see if that stone moves. Okay? The stone doesn't move. I'm gonna take a picture stating the patient's LPO. Okay? And then I'm gonna turn the patient all the way on their side. The stone still doesn't move. Okay? I'm gonna take a picture and I'm showing that. Then I'm going to turn them prone. Well, I can't get to the thing, but I'm gonna take them and I'm gonna shake them. I'm gonna shake them. I'm gonna go. I said, I know this feels funny, but I've got to make sure, you know, that all the anatomy's there where it needs to be. Okay. Okay. Then I'm going to turn on what? LAO. And now the stone is here. Okay? It didn't move with LPO, left lateral decube, but I shook it out of place. You can have the patient cough or anything that increases the abdominal pressure. This is what I usually do. Okay? Of course, if she's pregnant, I'm not going to be able to do that, right? Okay? Sometimes they won't do anything, and I'm gonna stand them up. Outstanding. Okay, and I'm gonna do upright. And I'm gonna label that upright. Okay? Because if I'm upright, it should fall down to the fundus, right? Mm-hmm. Okay? So I'm gonna write mobile. Okay? Because I took a picture here. I took a picture here. I'm taking a picture at LAO. It moved now, so I have to write mobile. There's something else that we need to do. Every image of the gallbladder is Murphy. Okay. Let me explain Murphy to you. Taking a deep breath, and when they take in that deep breath, you take your transducer and you push on the gallbladder. If they finish their breath, that's a negative Murphy. If you push it and they go, that is a positive Murphy. You never do a positive Murphy without a radiology consenting to it or a senior sonographer. You know why? That patient's going straight to surgery.
Wow.
Okay? So, this is the thing. Taking a deep breath. Push. They finish their breath. Negative Murphy. Taking a deep breath. Positive Murphy. Surgery. Okay? We don't make that call without someone else confirming. Okay, because they go straight to surgery. Okay.
Excuse me. This is means we did something, we move it so they should go to the surgery, or this is
That's
sent?
the test that we do
Mm.
to find out how inflamed their gallbladder is.
Mm. Yeah.
Okay?
Okay, so this is like a test.
A test. We do the test.
But only for
It's called a maneuver. Okay, do what?
Do we do that Murphy test?
Every gallbladder.
It's part of the protocol.
It's part of the protocol.
Okay, it's not if
No,
we're asked to
every
do it.
test. It's part of the protocol. Yes.
But you're saying the consent, the radiologist had to do a consent as well, so with that.
I'm not gonna call it a positive unless I have
Okay.
someone else confirm it. Okay, cause you're gonna have those ones, ow, ow.
Ah.
So what am I gonna do? Ow, ow. You think I'm gonna be able to cause because what's gonna happen is they're gonna hold the pain medication until we do the test. Because they want that Murphy to be either positive or negative. Ow, ow, ow. Really? So do you think I'm gonna be able to get a positive Murphy on these kind of patients? No.
Where exactly do you push?
You're gonna be looking at the gallbladder. You're looking at it live. Okay? My gallbladder can be down here. Mine's not, yours probably is. Okay? So I push on the gallbladder. I'm watching the gallbladder as I tell them to take in a deep breath. Take in a deep breath, and I push. Usually when I say breath is when I start pushing.
But you can do it by examination, by palpitation, deep palpitation.
It's a palpitation.
Yeah.
The only thing is we're using a transducer, which is a lot harder to push against the gallbladder than a hand. Because they've already done that test in the emergency room. Okay, and because they had a positive Murphy, they send them to us.
So which the
Our test will confirm the positive Murphy, because when we call a positive Murphy, we go and get a radiologist. I have a positive Murphy, can you come and confirm?
what is the most common location for the stone? Fundus or neck or common bile duct? The stone,
It's all common,
not common, no?
it's all
Oh,
common.
because it moves around.
Yeah, because it moves, it's mobile. We want it to be mobile,
Neck,
okay? Because if this is stuck here in the neck, okay, this is stuck here in the neck, and it's growing, what's gonna happen? Growing,
swelling.
growing.
When does it cause
Not
pain?
common.
Huh?
When does it
It
cause?
depends on your tolerance to pain,
Yeah.
okay?
So,
That's why the fasting, like the MetaFast diet that came back out in the 80s, is not healthy. Because when it first came out, you don't eat anything. You drink those 5 replacement meals a day, and that's not enough to empty out the gallbladder, and it causes hydrops.
I'm sorry, I missed the beginning of this, what you just said.
Hydrops.
Diet.
Which diet?
Manifest that.
Now they've revised it where you eat at least 1 meal a day. You can do that.
Who has this diet?
It MetaFast. They have clinics everywhere.
Oh, anybody can do it?
Yeah, as a matter of fact, if you go to Methodist to lose weight, that's what they put you on.
What is more?
Their own brand. If you go to Davis Weight Loss Clinic, that's what they put you on. Their own form of meal replacements, but you have to be under a doctor's supervision. Don't go to a clinic. Because you see a doctor maybe once a month if you request it, or if you start having problems.
More common the female, huh? Than male. it's related to the anatomy.
That I don't know.
The book says.
The book says, okay, it's also regional. Okay, like here, when they have gallbladder problems, we do a whole abdomen. If I worked in the valley, you know what they do?
He said for.
Just gallbladder.
He said like for risk factor.
Mm-hmm.
It's like start with F. Female, 40,
Mhm.
50.
And fair.
Okay.
Yeah.
So for F.
But it's also going to be regional because of